What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. I'm trying to make sure that you guys can hear me okay. So I'm in a new place. I'm in Kassel, Germany, Deutschland. I actually grew up here for 5 years back in the day, way back in the day. And this is a beautiful apartment. It's a 1-bedroom. This is the living room. Kitchen's over there. Really high, tall ceilings, high ceilings. Already baking some bread. I got some groceries I got in last night, and it's just lovely. I love these little towns because you can kind of, you never feel like it's too crowded, and it's super green and quiet. And it's a university town, so that's great. Anyway, wonderful place. Highly recommend it. So far, but we'll see what the rock climbing gym is like and what the downtown is like. I'll try to go there today. I'll be here for probably a couple of months, and one of the topics that I thought about recording an episode for is specifically for psychiatrists. I'll say psychology, psychiatry, just mental health. So the virtual space of mental health. And the reason I think this is important is because, as you guys know, this is definitely the trend of healthcare. Healthcare is becoming more expensive. It is becoming less accessible, and it is becoming more regulated. So everything from getting access to your physician or to your clinician, to getting insurance reimbursement, to getting your medications, your prescription, all of this stuff is becoming more complicated. So why is that important for us? The reason is, those of us who are interested in being in this healthcare space, in this entire clinical space, privately, engaging with patients directly, creating long-term relationships, have a huge advantage. Why? Because the large medical groups are going to have to tackle this. So they're going to have a major problem on their hand trying to retain physicians, trying to navigate laws, trying to figure out, if I have this psychiatrist that I hire, can I just replace it with a psychologist? Can I get an NP? Can I get a PA? And eventually what they're going to do is they're going to have to go after really crappy contracts with employers. That's the majority of what I think is going to be an affordable way for people in the United States, and especially Canada and Australia and other places these days, to get affordable access. Because even in other countries, I've actually just wrote about this on my digital nomad physician website, even those healthcare systems are collapsing in some ways, right? So the employers and the large medical groups are going after a whole different beast. However, there's going to be an ever-growing subset of individuals in the United States who understand that their health is going to be dependent on them. What they do to prevent it, what they do to treat it, and minimizing the amount of expenditure, it's what's going to probably even give them the most amount of benefit. Kind of like a car, right? If you just do oil changes and change a few bushings, change your tires, get that brake pad exchanged, or rebuild your brakes before the rotor gets destroyed, that's the least amount of money you're going to spend, and that's the most amount of effect you're going to have in the long term, as opposed to waiting until your transmission is no longer functioning because you didn't change the oil, or your engine is overheating because the transmission is failing. All of this stuff that just is all interconnected. So if you're a mental health professional, if you're a psychiatrist and you've been thinking about building something on the side while you're still working, this might be relevant to you, because there is a huge opportunity, and over the next few years, as mental health becomes a bigger and bigger and bigger deal, you have to understand that as a mental health expert, as a psychiatrist, you are in the driver's seat. You're able to help people with stress, with insomnia, right? With eating disorders, with addictions, substance use, and everything else in between. We have a huge problem with that. Not only with opioids, but benzos and smoking and alcohol and sex addiction and gambling and everything else in between. And when you look at the number of physicians who are in this space actually advertising directly to the consumer, there's very few. It's always the same old players. And one more thing, I think what's changing a little bit is the traditional traditional methods in which people communicate with search engines, let's say, is also changing. For the most part, every time I do research, it's always the same shitty websites that come up. And it's like, I don't fucking want to hear what Cleveland Clinic has to say. I don't care what the Very Well Health or some other crappy website, or Medscape or whatever the other one is. I don't care about that because I know they're getting paid to write that shit and they're just pushing a product. I want other. And even when I scroll way down on the list, nothing good comes up. No blogs come up. No individual physician opinions come up. All of that is now in, let's say, on Twitter, it's on LinkedIn, it's on Instagram, it's on Twitch, what is that other one? Whatever. Substack, and all these other places. That's where that information is now hiding. So the people who know what they're looking for, let's say, or at least can recognize quality, they're going to go to those places. They're not going to just do a search engine in Google because it's a waste of time. My Google searches are so useless these days. I'm doing a little bit more with Bard and with ChatGPT, but even then, unfortunately, it's still not that good, though it's a lot better, I think, and it certainly opens up a lot of options. And I'm saying this because in order for you to build some sort of a presence for yourself online, it's important to try to find where your community is going to be. Meaning, where are people most likely going to find you, and where do you feel the most at home? Do you feel the most at home creating podcasts? Great, you can be the biggest podcast on addiction. Do you feel most comfortable maybe on Facebook? Great, that's where you should be. Do you feel most comfortable on Instagram? That's where you should create content. If you don't know how, but you like that platform and that's where you get your information, then that is the place that you should probably do it. For me, I always say written, audio, and video. Those three things are probably going to be queen for the next few decades to come. So if you create those, it doesn't really matter where you put them, right? So get your phone and create that content on your phone. Create the video content on your phone. Create the audio content on your phone. I have different phones for different things, but there's some really good technology out these days where with your phone, you can create really good videos, you can create really good audio. And then the writing is very straightforward. And these days you can get a lot of help with the creative part of it. So for example, let's say you want to write about a topic and you get stuck in something, you can use things like ChatGPT, these what they call large language models, or you can use Bard. And it's going to give you some ideas, right? It's going to help you like, oh yeah, I could say it this way, or I could rephrase it, or I could actually talk about this aspect of it. So those are wonderful tools and assets to use. And once you have that, you can always hire a social media marketing expert to take the written content, add it to your audio content, add it to your video content. You've created that content already. But finding one place or two places, three places where you like to be is important. Number one actually was find that niche, find that one particular thing that you're excited about, that you're interested in. It could be general pediatric mental health. It could be autism. It could be dementia. It could be mild cognitive impairment. It could be neuropsychiatric disorders. It could be substance abuse. But when you find that niche and you mostly just talk about that, not only do you realize how deep that topic can get, you start incorporating, so that I'm talking about deep versus wide, right? Kind of building that triangle. It depends on how you want that triangle to be. Really broad, like family medicine, or super steep, like, vascular surgeon, for example. And so as a mental health expert, as a psychiatrist, you can try to focus your information. Eventually that information will find the right people. How do I know that? Because that's how I created all my websites. Digital Nomad Physician, Digital Nomad Health, Heart Health Coach. All of these websites, all of these brands have a good enough following, enough people come to me, I make enough money from them that I'm super content, super happy. And the reason is you just keep putting that content out there. Unfortunately, also we're in this new model where clinical information that you put out there is not as easily searchable. And the reason is the search engines are trying to be a little bit conservative. They're trying to not give information to the public that could harm them. I totally understand that part. But I think this infantilization of our society, of American society, some of the most successful, wonderful people out there is idiotic. It just doesn't make any sense. It's like going backwards, but it is the direction that we're going in. So if you are a psychologist, if you're in the mental health space, you need a website. I think having a just beautiful, simple landing page with 3 menu things on top, information about you on the bottom, That's the basics. Then starting to create content, then trying to decide what your niche is, and then decide, do you want to be in the coaching space or do you want to be in the clinical space? To me, it makes the most amount of sense to be in the clinical space initially. You can always create an offshoot of coaching, but for psychiatrists, for mental health experts, I think staying in the clinical realm is really good. And start learning how to set up a really beautiful audio-visual system. If you have a nice house, great. If you don't, find a great co-working space. I think the majority of people these days are probably going to look for virtual options. Now, you might disagree. You might say, no, I think more people are turning towards the in-person practice. And you can always add that in the future as well, right? You can build your online presence and then say that, hey, for this community, that's where I get the majority of my patients, I'm also going to have a physical office once a week, twice a week, once a year, twice a year, whatever. But there's a lot of options from that, right? You can do group coaching, you can do individual sessions one-on-one, you can sell online courses on your platform. So there's so many things that can come from that. I'm just thinking about the substance abuse space, right? You could start an urgent care with your name, with your brand, right? That brand that you build is going to be the key. And if you advertise online, if you get your information out there, people are going to find you. They're going to book sessions with you, whether you're charging $100 or $500 or $1,000 an hour. That's going to be up to you, and it's going to depend on how comfortable you are. Also, charging that much money, right? I'm comfortable charging $500 an hour for my heart health coaching. I have no shame in that. But for my primary care stuff, for my ongoing kind of direct primary care stuff, I charge $100 a month. I wouldn't want to charge $200, $300, $400 a month and expect someone to have that expectation of me, right? But it's going to be a good income, and it's going to be the kind of patients that you're going to want, because the content you put out and that content that people find, those people are going to gravitate towards you based on how they're seeing you. And everything else is really simple. If you want to find a good telemedicine platform, you can use Acute Health, you can use Atlas MD, you can use Chrono. Dr. Chrono. There's a lot of different options out there these days. It doesn't have to be complicated. Sending controlled medications over to the pharmacy is not difficult these days. Having a good electronic medical record is not difficult these days. But I think what's going to set you apart is maybe the kind of communication you have, how easy you make it for patients to find you online and to book that appointment, right? Those are things that I think many of us physicians still haven't mastered, while others have. Attorneys have done a good job of that. And creating that really beautiful interactive system. For example, you can have 3 cameras on you. The person can see you in a really beautiful quasi 3D model and with a big screen, and really good audio, really good, and record the session, send them the recording, send them notes afterwards, send them the transcript afterwards, have somebody summarize the transcript. There's a lot of things that you could do that can make you stand out as a mental health expert, especially if you're thinking about the virtual space. Even if you're working full-time for somebody else right now, you can always build this on the side. And if it becomes something that you're excited about, you have all the other options in the future. I hope this is helpful. Check me out at digitalnomadphysician.com. Leave your comments below. I'm curious what you guys think. I'm curious what you've thought about, what you've wanted to do, and maybe where you've gotten stuck. Take care.